Hello parents, my name is Dr. Chifor Terry and I'm a pediatrician aka your favorite baby doctor. Today we're going to be talking about a topic that concerns most of us, if not all of us, which is worm transmission in children. Woo! Before we go ahead to talk about worm transmission in children, let's talk about what causes worm transmission in children. Worms can be transmitted from contaminated soil or water, undercooked food or raw food, or from an infected person. There are several types of worms that infect children, and depending on the worms that your child have, that's what's going to determine how your child is going to present. Examples of worms include roundworm, hookworm, pinworm. So what are some of the signs and symptoms of a worm infection? There are many signs and symptoms and are not very specific, but some of them include: number one, abdominal pain. The child may be complaining that they feel like vomiting, that is nausea. They may have blood in stools. They may not be gaining weight appropriately. They may just feel very tired and lethargic. For some children, they may complain of itchiness around the anus, especially at night. It's a very common symptom. And then for some reason, some children develop pica, which is craving for non-nutritive things, like they want to eat chalk, they want to eat soil. If your child has any of these symptoms, you may begin to suspect that probably your child has a worm infestation, coupled with the fact that you live in an unsafe area or unsafe drinking water, or an area that has, soil and ponds and water bodies. You may suspect that your child has a worm infection. I recommend that if you suspect that your child has a worm infection, please see your healthcare provider. They're going to do some tests which can actually confirm that and give the appropriate medication to help your child deal with that worm infection. So what are the consequences if this infection is not treated? We as pediatricians worry about worm infections in children because if they are left untreated, they can have many consequences, such as what? Your child may become anemic because those worms attach to the intestines and they suck blood. Your child may not gain weight properly, which is not good for your child. Number three, when there's a heavy load of infestation, they can block your child's intestines. So your child may develop what we call an intestinal obstruction. And in some cases, the worms and the eggs can migrate to other parts of the body. They can migrate to the lungs, causing a lot of cough. They can even migrate to the brain. They can cause an abscess. They can cause seizures. So we really don't want to leave worm infestations untreated. Now let's talk about how do we prevent worm infections. When it comes to worm infestations, prevention is always better than cure. And here are some tips to prevent your children from getting infections. Number one, hand hygiene remains the top. Always ensure that you wash hands when you change your baby's diaper, when your child goes to the toilet, before eating and after eating. Always ensure that they wash hands. Number two, ensure that your child's play area is very clean. It's free of soil, it's free of puddles, it's free of water, because some of those worms, like I've told you, they live in infected soil, they live in infected water, and your child being in contact with those things can make your child get the worm infection. Number three, ensure that the food that you give your child, especially meat and pork, it is properly cooked, because some of those worms can survive in improperly cooked food, especially pork. And when the child eats it now, the child gets the infection. The next thing you can do is always ensure that when your child is playing outside, like if you're going to the park or an outdoor play, your child wears properly fitted shoes so that they don't get that infection from stepping on those worms. Ensure that your toilet is always properly clean, be it a pit toilet or a normal flushing toilet, is always clean. Your baby's potty is always clean so that the residues of those worms won't be left there, especially if somebody has to touch it. Keep your child's fingernails short and clean, because some of the eggs of some of those worms can hide beneath the fingernails, and if your child, especially when they start walking, they touch those things, it hides under their fingernails. They put their fans in their mouth, they can easily get the infection. So always ensure that their fingernails are short and clean. If you have pets such as dogs and cats, also ensure that they get dewormed regularly, because children like to play with these pets, and most of the times when they play with these pets, they don't clean their hands after that and they can get that worm infection. And finally, we have what we call the chemoprophylaxis, that is the medical prevention of worm infestation, which is what we have worm medicine. You have mebendazole or albendazole, and WHO recommends that you give your child worm medication every 6 months, starting from the age of 1 year, especially if you live in an area that has a lot of worms. I hope you have found this helpful and you have learned something. If you have, please like, share and comment. Until next time, your favorite baby doctor.